very much, Chair and members. We've circulated a statement and I thank you for the invitation to provide an update on our national response to COVID-19. I'm joined today by Deputy Chief Medical Officer Dr. Ronan Glynn and Professor Philip Nolan, as we said, Chair of the Irish Epidemiological Modelling Advisory Group. While we're clear that the pandemic is not over, the epidemiological profile of COVID-19 nationally provides a broadly positive outlook. A range of data indicate that incidence is high, but has reduced from its peak, and demand for testing and PCR positivity in the main have also reduced. The number of confirmed cases in hospital has also decreased, with the average number of newly confirmed cases in hospital also reducing. The total numbers of confirmed cases in ICU, daily admissions and cases requiring mechanical ventilation have decreased, and the number of COVID-19 patients in receipt of advanced respiratory support in hospital setting outside of ICU has also reduced. The evidence in relation to the variant Omicron, as well as our experience of it, indicate that the burden of severe health outcomes appears reduced compared to previous waves of infection with other variants. In addition, overall COVID-19 related mortality remains relatively stable at this point. We are in this much improved situation as a result of the population's engagement with the vaccination programme and the booster programme in particular, and the high levels of adherence to public health measures, as well as the reduced virulence of Omicron. Given this, on the 20th of January, the NEFIT recommended a fundamental change in the approach to the management of COVID-19 in its advice to government. In broad terms, the transition from a focus on regulation and population-wide restrictions to a focus on public health advice, personal judgment and personal protective behaviours was recommended, and government was advised on the removal of the majority of the remaining public health measures. In advising that social and economic restrictions could be removed, the NEFIT stressed that the pandemic is not over, and that with a significant level of infection nationally, COVID-19 still poses a risk to public health. In this regard, there will be an ongoing need to retain some of the public health measures that are still in place for the month of February, and those will be reviewed towards the end of this month. Protective measures should remain in that regard in place in primary and secondary schools. Masks should continue to be worn in all settings where currently regulated for, and we must continue to encourage everyone to complete their primary and booster programmes of vaccination. In this regard, I would urge anyone who has not yet received their booster dose or completed their primary course of vaccination to do so as soon as possible. The main purpose of vaccination has always been to prevent serious illness and death. COVID-19 vaccines continue to prove remarkably effective in this regard, especially for those who have received their booster. The wearing of masks will also continue to play a key role in reducing transmission of COVID-19. It is important that people wear the mask that is most appropriate to them and the circumstances they may be in, ensuring it is well fitted and worn correctly. It remains critically important that if you have symptoms of COVID-19 or indeed any respiratory viral infection, you must self-isolate immediately. And those who are identified as a close contact of a confirmed case need to follow the appropriate public health measures for them. It is recognised that the removal of restrictions, while very welcome, will cause anxiety for some people. In particular, this may be the case for many people who are immunocompromised or more vulnerable to the severe effects of COVID-19. I wish to reassure those who may be anxious that the risks associated with COVID-19 are greatly reduced through vaccination and boosting, and that with appropriate caution, they can go about their daily lives. At a societal level, the COVID-19 pandemic has impacted on the physical and mental health of many. It is important that people are assured that while the pandemic is not over, it is safe to return to the activities we all enjoy in terms of socialising, exercising, family, work and travel. While, as I've said, the current outlook in Ireland is positive, the global epidemiology of SARS-CoV-2 is characterised by the emergence and rapid spread of the Omicron variant, the continued decline in the prevalence of the Delta variant, and a very low level of circulation of Alpha, Beta and Gamma variants, the earlier ones we had in this country. The evolution of SARS-CoV-2 can be expected to continue. Omicron is very unlikely to be the last variant of concern we will have to face, and the global public health risk remains very high. Therefore, we must remain vigilant and ensure that our response is agile and flexible, with an ability to respond rapidly and appropriately to any emerging threat that might arise. And Chair, I thank you for the opportunity to make the opening statement, and we're happy to answer any questions that you and your committee members will have.